Okay, so this time what I wanted to do was talk a little bit about Inman Aligners. Now, in my practice, we have 3 types of orthodontic options for you. You can do Invisalign, a little bit more comprehensive, different goals involved. 6-month braces, that's using tooth color brackets and wires, focusing more on the anterior 6 teeth or the front teeth. And we also offer Inman Aligners. It's another removable appliance that is similar in Invisalign because it's removable, but different because we're using completely different physics involved. Now, the question then becomes, what if you could straighten your teeth in a matter of weeks as opposed to a matter of months? And that's kind of what we're trying to do with Inman Aligners. Now, we are also limiting our goals and expectations. We're not trying to go perfect. We're not trying to fix necessarily your bite, although the bite can be affected and often improved. Sometimes to create room or space, we need to expand the arches a little bit, and the Inman Aligners can allow us to do that. The average case, typically the Inman Aligner website will tell you anywhere between 6 and 20 weeks. That does require some input or effort on your part to make sure you do your thing. Teeth in general takes 10 hours of continuous pressure to get the teeth to actually start to move. And so if you only wore it for 11 hours a day, it's not going to work very quickly. We recommend about 20 to 22 hours a day of wear. Take it out while you eat and while you brush your teeth, and that's it. So I have had some patients not wear it as recommended. For whatever reason, they decided they just wanted to do it about 15 hours a day. Really had very limited results, a little bit of frustration. So if you follow the directions and you are dedicated to wearing a removable appliance, then you can consider an Inman Aligner. Not all cases are appropriate for Inman Aligners, but more cases than maybe you might think would work very, very well with an Inman Aligner. We charge per arch, but it is something that quite often we're doing just a single upper arch with the Inman Aligner. Now, the process makes sense. What we're trying to do is use looks like a retainer that has a bow on the front of the teeth and a bow or an arch on the inside part of the teeth that has springs attached to them. So the front part is kind of pulling the teeth inwards, and the inside part is pushing the teeth outwards. So when it's in place, what we're trying to do is with slow, gentle forces, we're able to get the teeth to move into place. Now, the outer bow is going to have recessed areas where the teeth should fit into, and as the teeth are pushed into that area, they can also rotate. Now, the rotation correction is going to be limited to a certain degree. It can rotate, but if you have significantly rotated teeth, you probably aren't going to be able to use Inman Aligners. Early on, the aligners are only putting pressure on a single tooth. Eventually, as that tooth moves into position, the other teeth are touched or affected and then can be pushed into or tipped and rotated into place. So Inman Aligners are convenient. They allow you to eat whatever you want. You're going to be able to brush and floss like regular because there's nothing on your teeth at the time. Sometimes we do have to bond a little bit of some composite material on the teeth just to help make sure that the aligners are placed correctly. But for the most part, there's very little, if anything, placed on the teeth at all. It's an alternative to brackets and wires. Now, things that the Inman Aligners can work for: crowded upper and lower teeth, protruding front teeth, gaps between the teeth, uneven teeth, misalignment, and also complete smile makeovers. Quite often what we're trying to do, we do what's called pre-prosthetic alignment. People come in, they want porcelain veneers, but if we veneer their teeth with the alignment that they currently have, we have to be fairly aggressive. Sometimes really to do things the way that they want restoratively would require maybe some root canals or even extracting teeth and doing bridges. Whereas if we can do pre-prosthetic orthodontics, move the teeth before we veneer them, then we can be very, very conservative in the amount of tooth structure that's required, or maybe even not have to remove any tooth structure at all and just place porcelain over the teeth to give us the proper color, the proper dimensions, the shape and the size of the teeth. And if we straighten them first, then we can do that all very, very conservatively. Now, we recommend that if you're going to be doing the Inman Aligner therapy, that we're going to see you every 2 weeks to adjust and monitor and maintain the case. What I mean by that is it's a commitment to the case, but it's also a commitment of time. And if you're not able to come in every 2 weeks for us to polish the friction that the teeth may have or adjust as needed or monitor the case, then this may not be the right case for you, the right treatment for you. It also might mean that it's just going to be a lot longer. And instead of 16 weeks, it may end up being more like 30 to 40 weeks. And at that point, if you're going to take that amount of time, you may want to consider something a little bit more definitive, a little bit more like brackets and wires, like a 6-month braces. But if you can commit to coming in every 2 weeks, and the nice thing is each visit usually is only about 10 minutes each. They're very quick visits, but that does require repeated visits back. So if you live a great distance away, it may not work very well. As with all types of teeth alignment treatment, orthodontics of any sort is going to require some form of retention. When we're all done, you're going to have to wear a retainer. Quite often what we do in our office is we'll bond a wire on the back of the teeth to keep teeth in place, and also do a clear type of tray type of retainer to help keep everything in place. And a combination of the two, it's in a way, it's like wearing your belt and suspenders at the same time. But it does prevent teeth from moving or minimizing the amount of movement that will happen after we're all done. So if you're not committed to wearing a retainer or a retention system of some sort, then any orthodontics really is not the right treatment for you, and maybe we should consider something else. But if you're committed to wearing a retainer, we like to tell people it's almost like if I gave you a nightgown that all you had to do was wear it every single night, and it kept you skinny, would you wear it? And most of my female patients, my male patients, nightgowns aren't necessarily for them, but my female patients would say, yeah, if I had a nightgown that would keep me skinny for the rest of my life, I would wear it every single night. That's essentially what we're recommending with a retainer or retentions of a system of some sort. I hope this answers all your questions about Inman Aligners. Feel free to give us a call or an email, smiledoc70@hotmail.com, office of drtimmerman@gmail.com, or give us a call at 206-241-5533. Let us know how we can help you. Give us a call. We look forward to meeting you.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomate in the American Board of Dental Sleep Medicine. If you would like to become a patient of Dr. Timmerman or simply have questions, please go to our website, www.drtimmerman.com. That is www.drtimmerman.com. Or call us at 206-241-5533. Or you could email questions for an episode of a future podcast at thewholetoothpodcast@gmail.com.